Hello everyone. Let's talk about hemato-oncology pharmacology. So these medications are for cancer. There are different types of group that we can use for treating cancer and cancer related symptoms. So first we do have chemotherapeutic agents. In that we do have few examples here. Busulfan, cyclophosphamide, methotrexate. So this one is important medication, methotrexate for your exam. Vincristine, bleomycin, important. Doxorubicin and daunorubicin. These are also important medications. So cyclophosphamide, methotrexate, vincristine, bleomycin, daunorubicin, and doxorubicin. These are the different types. These are the different subtypes of chemotherapeutic agents. So overall, for all these medications, what is the main mechanism of action? So it either destroy or either inhibit the growth of cancer cells. Either it destroy or inhibit growth of cancer cells and prevent their spread. So we are going to look into more detail about the side effect, that what are the side effects can occur from all these medications. But in general, when you are preparing these chemotherapeutic drugs for administration, you have to use the full PPE and then you can prepare the medication. Also, this medication has common side effect as a nausea and vomiting. Nausea, vomiting. So every time you administer this medication, before that, you have to give antiemetics medication to the patient. Also, alopecia is a common side effect. So that's a psychological concern about the body image. So you can allow the patient to ventilate their feelings. And also bone marrow suppression that decreases WBC, platelet, and RBCs. So you need to monitor CBCs, complete blood count, every time when patient who is on chemotherapeutic drugs. Another group that we can use is hormonal therapies, that hormone related cancers. So one of them is most important medication is tamoxifen. So this tamoxifen blocks the estrogen receptor and reduce the estrogen effects to slow or stop the growth of hormone sensitive cancer, for example breast cancer. So hormones related cancer is the one of the medication that is helpful, that is tamoxifen. So tamoxifen is prescribed in breast cancer because it blocks the estrogen receptors and thereby reduce the estrogen effect to slow or to stop the growth of hormone sensitive cancer. Generally when patient who is on menopause and if they are not able to tolerate the other symptoms like hot flashes or mood swings, irritability, those are the menopausal symptoms. Some of the patient do require hormonal replacement therapy. When they are on hormonal replacement therapy, estrogen is being administered to them in the form of the oral medication, and so those patients are at high risk of developing cancer related to hormones. So if you give this tamoxifen to the patient, think about menopause symptoms as a side effect. Okay, think about menopausal symptoms as a side effect. Why? Because this medication blocks the estrogen receptor and thereby decrease the estrogen. So if you can see here the side effect like hot flashes, vaginal dryness, mood changes, these are the menopausal like symptoms. This patient, when this patient is on this medication, you have to assess the patient for risk of blood clots, teach the importance of taking medication as prescribed, monitor for liver function, and encourage report of unusual bleeding. So you need to monitor this patient for bleeding, clot, menopausal like symptoms, and liver function. Okay, another group that we do have is hematopoietic drugs. So as we know that this chemotherapeutic drugs suppresses the bone marrow, because of that RBC decreases, and with decreased RBC patient develop anemia. So sometimes we need to give hematopoietic drugs from outside to stimulate the bone marrow to increase the production of white blood cells count and red blood cells count. Okay, so the common medications which are used as epotin alpha. This is important for your exam. Epotin alpha, and the other one is filgrastim, but this one is most commonly used, epotin alpha. When you give this to the patient, every time before you administer this, you have to check the CBC. to check the level of RBC, WBC, and hemoglobin. So next time before you administer, if you repeat that again, you will have idea how much, it is increased, whether this treatment that we are giving to the patient is effective or not. Assess for the bone pain, especially with filgrastim, and monitor for the blood pressure with heparin alpha. So this side effect you need to remember with heparin alpha. Teach to report the short of breath, chest pain, and swelling. Next is about the iron supplement. So iron supplement like ferrous sulfate, iron dextran that you can give to the patient to replenish the body iron store and treat and prevent iron deficiency anemia. Take with food to reduce GI side effect, that is iron sulfate, and monitor for constipation, dark stool. For iron dextran, that is IV, monitor for the allergic reaction and teach to keep out of the reach of children, that is iron overdose can be harmful. So this was the brief information about the group of the medication that we use for chemotherapy. Chemotherapeutic agents, the examples are cyclophosphamide, methotrexate, bleomycin, doxorubicin, daunorubicin, vincristine. These are the medication. Hormonal therapies, tamoxifen is most commonly used medication for breast cancer or hormone-related cancer. Hematopoietic drugs like epotin alpha and filgrastim, and the another one is iron supplement. Okay, so let's talk about the chemotherapeutic agents. So drug class and examples. There are subtypes of chemotherapeutic agents are alkylating subtype, that is examples are busulfan or cyclophosphamide. There is another group antimetabolites, in that methotrexate is the one. Third one is mitotic inhibitors, in that there is a vincristine or paclitaxel, and anti-tumor antibiotics, bleomycin, daunorubicin, and doxorubicin. You don't have to remember the subtypes, but you need to remember selected medication for the exam. Okay, when you are going to see this medication as a treatment, so when patient has leukemia, lymphoma, breast, lung, ovarian cancer, depending upon the cancer type, stage, and treatment goal. So oncologist will decide that what type of group for the medication is going to be used for the particular cancer. What you need to remember as a side effect is this is a common side effect from all chemotherapeutic drugs, that is bone marrow suppression can occur. Bone marrow is something that helps in production of WBC, RBC, and platelet. When patient bone marrow is being suppressed, RBC decreases, platelet decreases, WBC count is also decreased. With that, what happens is if RBC goes down, patient will develop anemia. If WBC counts goes down, then patient will develop neutropenia, higher risk of infection. And if platelet goes down, patient develop thrombocytopenia. Patient with anemia will have fatigue, pallor, tachycardia, short of breath, chest pain. So you need to monitor hemoglobin all the time, and you have to advise the patient to take iron-rich food. Neutropenia patient will be at high risk of getting infection, so you have to monitor for neutrophil. Private room you should provide the patient to. Why? Because patient has high risk of getting infection from other people. No flowers, no fresh fruits, and in the patient's room, and you have to report infection. And if patient develop fever, that's emergency. Why? Because patient does not have enough immunity to fight against that infection. Any patient has decreased platelet count, it increases the bleeding risk, and so you have to advise the patient to use soft toothbrush, electric razor, not the regular one, and you have to monitor for bleeding. So the one side effect from chemotherapeutic medication is bone marrow suppression, that decreases RBC, WBC, and platelet. RBC decreases, high risk of anemia, platelet decreases, high risk of bleeding, and neutropenia, high risk of getting infection. Another side effect is about the organ toxicity. So these medications can affect organs. Okay, they damage the organ. So talking about the pulmonary toxicity, that means lungs get affected. With what? Bleomycin. How I remember? I do remember bleo as a blue related to cyanosis, right? Cyanosis related to lungs. So pulmonary toxicity is by bleomycin. Blue, cyanosis, lungs. Okay, so bleomycin. You have to monitor the patient for any cough, short of breath, and you have to monitor the patient for pulmonary function test. So if patient who is on bleomycin, you check for the blue, cyanosis, lungs. Cardiotoxicity, heart can get damaged. So heart related side effects you have to remember in doxo and daunorubicin. Doxo, daunorubicin, it causes cardiac toxicity. Okay, so when patient who is on doxorubicin, daunorubicin, you have to monitor the patient for the heart failure signs and symptoms. If let's say patient who is coming with lower extremity swelling, patient who have fatigue, patient has short of breath, edema all over the body, or maybe specifically in lower extremity, then you have to think about checking or monitoring heart. Then chemotherapeutic drugs in general causes alopecia, that is hair loss. Okay, so you need to provide support, allow them to ventilate their feelings about their body image disturbance. You can give them different options of wigs, scarves, and chemotherapeutic medication causes nausea and vomiting. That is the most common side effect. And for that, you have to give antiemetics before giving medication. Okay, so that will, help the patient to tolerate the chemotherapeutic drugs. Okay, and when patient is on this medication, you have to keep checking the patient hydration status, because if patient has nausea, vomiting, patient can be easily dehydrated. Common side effects from all this chemotherapeutic drug is mucositis. So mucositis, inflammation of mucosa. So you have to keep checking the patient's mouth. You have to give frequent oral care to the patient, and you have to advise the patient to avoid all different kind of irritants while eating food. Another side effect is related to reproductive system, and there is one complication that you have to remember is tumor lysis syndrome. This is also considered as oncological emergency. Oncological emergency. So reproductive and tumor lysis syndrome. So what happens in reproductive system? So these medications are teratogenic. Fertility can get affected. So for younger patients who are diagnosed with cancer, we should give them different options of like sperm banking or adoption, surrogacy, all these different kind of options that we can give to patient, depending upon their type of depending upon the type of cancer, age, so many things we need to consider, but there are different options that we can give them. And these medications are definitely teratogenic. Also, these medications damage the healthy sperm cells. So fertility is definitely getting affected. Contraception, you need to talk about when patient who is on this medication, because we don't want this patient to get pregnant or have kids, because these medications are teratogenic, so we don't want any congenital malformation. Fertility counseling we need to provide to the patient. And tumor lysis syndrome. So what happens is when patients start taking chemotherapeutic drugs, this medication is going to destroy the cancerous cells, right? And so there is a whole chemical process occur, and because of that, electrolyte imbalance occur. In that, what happens is uric acid level increases, potassium phosphate imbalance also occur. In this case, when potassium, phosphate, uric acid, all these things are getting abnormally high, what happens is the kidney damage can occur. Why? Because kidney has to handle all this electrolyte. Okay, and so kidney damage can occur. Because of the potassium imbalance, arrhythmia can also occur. So this is something that we need to monitor once doctors start on chemotherapy. You need to monitor for all this electrolyte level, and to prevent or to protect the kidneys, you have to keep patient well hydrated. You have to monitor frequently the labs, and you have to give allopurinol to the patient. Allopurinol is for what? For decreasing uric acid. Okay, decreasing uric acid. In general, for safety and handling hazardous drugs. And so what you need to do, you need to use PP while preparing these medications, and you have to give fluid to the patient to prevent kidney damage, and also to keep the patient well hydrated. A patient who is on this medication, after each use of toilet, there should be double flush, okay, to prevent the harm to other people who are using bathroom. Extravasation is the another side effect. These medications are so toxic. There is a chance that this medication can infiltrate and can cause tissue necrosis. Okay, so these medications, when they are being administered, it is your responsibility to check the IV line site frequently to prevent tissue trauma. Medication mostly will be given by central line, but IV line monitoring is as important. In general, like if that happens, extravasation occur, then you need to stop the infusion right there. You have to leave the catheter and you have to give antidote to the patient. Okay, you have to reach out to the doctor for that as well, but doctor will be giving you the information about the antidote. Okay, so another group that we had discussion about is hormonal therapy. In that, the tamoxifen is most commonly used medication, as we talked about. Tamoxifen works on estrogen receptor. It blocks the estrogen receptor, thereby decrease the estrogen, and is helpful in breast cancer. Okay, so how it works, it blocks the estrogen receptor, inhibits growth of estrogen dependent cancer cells, prevent estrogen from stimulating cancer cell growth. What are the nursing interventions that you need to keep in mind for this medication? There is a higher risk of blood clot, so there is increased risk of DVT, pulmonary emboli. So this is important point for your exam point of view. When someone who is on tamoxifen, you as a nurse will be keeping eye on DVT, unilateral leg swelling, redness, pain in the calf area, or all of a sudden patients start developing short of breath, chest pain, tachycardia, or decreased oxygen saturation, then possibly patient is experiencing pulmonary emboli. So you have to be very quick in taking intervention. Okay. Tamoxifen promotes clotting factor production, and because of that, there is a higher risk of DVT. So you need to monitor the patient for unilateral leg swelling, chest pain, short of breath for pulmonary emboli. Another risk is there is an increased risk of endometrial cancer. Okay, so anytime if patient comes with abnormal vaginal bleeding, okay, abnormal vaginal bleeding, you have to be little cautious thinking about association of this medication with endometrial cancer. Okay, so anytime if any menopausal woman, let's say they are coming with a complaint of vaginal bleeding, you have to take interventions promptly. Okay, so tamoxifen is a medication that is useful in hormone sensitive cancer like breast cancer. This medication, how it works, it is going to block the estrogen receptors, thereby decrease the estrogen, and so it is useful in hormonal sensitive tumor. Main two side effects you need to remember: bleeding and clotting. Clotting, you need to watch for DVT as well as pulmonary emboli. And bleeding, any patient who comes with abnormal vaginal bleeding, you have to take the intervention immediately for that patient. Okay, all right. Another one, the hematopoietic drugs. Examples are apotene alpha and filgrastim. So I would advise you to remember this apotene alpha. The main purpose of using apotene alpha is to increase red blood cells. How it works, it stimulates the bone marrow, and so it is going to help in increasing blood cells. Okay, now it is used for often after chemotherapy or in chronic condition like chronic kidney disease. I do have few patients who are on apotene alpha because of their advanced chronic kidney failure. Their kidneys are not helping in promoting erythropoietic process, and so from outside we have to give this erythropoietin as a synthetic hormone to stimulate the bone marrow to increase red blood cells and white blood cells. So every time we order that apotene alpha, we need to order for CBC. We do order CBC, we check the count, and then will be administering that. Okay, so it helps in production of RBC. Overproduction can lead to high blood pressure, and there is increased risk of blood clot. So these two you need to remember. Overproduction by apotene alpha increases high blood pressure as well as increases risk for blood clots. Monitor hemoglobin level all the time, and we do check if patient's hemoglobin is more than 11, then generally we hold apotene alpha. When someone hemoglobin is less than 11, then generally we do give this apotin alpha to the patient. So you have to monitor for thrombosis signs and symptoms like pain, short of breath, unilateral leg swelling, confusion. So basically here we are checking the patient for DVT, pulmonary emboli because of increased risk of clot. Okay, if patient who has more than 11, you need to hold. Why? Because that's how you can protect the patient from stroke or myocardial infarction. Okay, so selected side effect that you need to remember is high blood pressure, increased risk of blood clots. So you need to monitor the patient for DVT and pulmonary emboli, and hold the dose if patient hemoglobin is more than 11. Okay, another one is filgrastim that stimulate the production of neutrophil, and monitor the CBC to assess the neutrophil recovery. Bone pain can occur and it is managed with a non-opioid pain medication like Tylenol, acetaminophen if needed, and avoid aspirin if thrombocytopenic due to increased risk of bleeding. If patient has thrombocytopenia, so you need to avoid aspirin because that can increase risk of bleeding. All right, next is about the iron supplements. So with iron supplements, we do use oral form of iron supplement, that is ferrous sulfate, and the IV form of iron supplement, that is iron dextran and iron sucrose. IV form iron dextran, iron sucrose, and the oral form is ferrous sulfate. Okay, how it works, it replaces the iron needed for hemoglobin synthesis, RBC production, and iron deficiency anemia. It helps in hemoglobin synthesis, RBC production, and iron deficiency anemia. What you need to remember? So always do remember that whenever you administer iron, patient is going to develop constipation. So you need to add more fluid and fiber, and mobility is the best thing that you can advise the patient. Also, the color of the stool can change, so that you need to advise to the patient that you may get black stool, okay, but that is harmless and it is expected side effect. All right, and you have to keep this iron out of reach of children. Why? Because accidentally, or if they take as a overdose can be harmful. So side effects, and also one important thing, iron should be given with vitamin C for better absorption. So take on empty stomach with vitamin C or maybe orange juice to increase absorption. Avoid taking, this is important intervention to keep in mind, avoid taking with milk and calcium supplement. Avoid taking with milk and calcium supplement, calcium carbonate. Why? Because they decrease absorption. So empty stomach with vitamin C. Avoid with milk, dairy, calcium. Okay, it can cause constipation, so you recommend stool softener. Black stool, that is expected harmless side effect from iron. Liquid ferrous sulfate may stain teeth, specifically for children, that we need to be keeping eye on. So patient is advised to use straw or rinse mouth immediately after administration of iron. You have to keep out of reach of children. Iron overdose can occur if they do take accidentally, and that is a fatal poisoning. Okay, iron dextran, that is IV administered test dose due to increased risk of allergic reaction. It does happen. I did have one student whose hemoglobin dropped to 7, and doctor had advised her to take iron supplement IV. So with first dose, she had developed allergic reaction. So it was changed to something different. But please do remember, with IV iron dextran, there is a higher chance of allergic reaction. Okay. All right. Thank you.